As per a study by Totten et al., telehealth offers significant benefits for increasing provider capacity in rural settings by improving access to specialist care, enhancing care coordination, and reducing system inefficiencies. So, virtual specialist consultation, including synchronous video visits, asynchronous e-consults, allow rural primary care providers to manage more complex cases locally with specialist guidance. This approach reduces unnecessary patient travel, shortens wait times, and decreases the need for in-person referrals. So thereby that optimizes both rural and urban provider workloads. DeHart et al. State that telehealth also supports remote follow-up care and chronic disease management. So where I live in Saskatchewan, if you go up north, it's quite, population is quite dispersed. Significant indigenous population with high genetic risk of diabetes. So chronic disease management, very important there. And up north, there may only be a nursing station. So that nurse also depends on provider diagnosis via telehealth, as per the government of Saskatchewan. So telehealth particularly valuable in rural settings where travel distances, as mentioned, and weather can impede access to care. So virtual visits for medication reviews, as per Totten et al., and chronic disease monitoring improve appointment adherence and continuity of care while allowing providers to reserve in-person visits for higher acuity patients. DeHart et al. State that remote patient monitoring further enhances capacity by enabling early identification of clinical deterioration, helping prevent emergency department visits and hospital admissions. Totten et al. State that in addition, telehealth strengthens provider collaboration and mental health service access and workforce sustainability in rural settings, including where I am, rural Saskatchewan. Telepsychiatry and virtual counseling expand access to mental health and addiction services, reducing pressure on emergency services and primary care providers. Telehealth platforms also facilitate interdisciplinary collaboration, continuing education, and peer support, helping reduce professional isolation and burnout among rural clinicians. And improved provider support and flexibility may enhance job satisfaction, retention, indirectly increasing long-term provider capacity in rural communities. So some of the technology that may be utilized, of course, secure video conferencing platforms, which is available at, if I'm thinking extremely rural, at the nursing stations or at clinics. And if that patient, I guess, does not have video, does not have broadband access, then a telephone may be utilized actually. Electronic medical records, of course, and health information systems, government of Saskatchewan, as per them. And also there's patient portals. So if you get blood work done or a diagnostic test, you may look up your results. It's called Health Viewer. And there's also diagnostic and peripheral devices. So at the clinics, of course, and nursing stations, they may have an advanced practice nurse that is trained to utilize some of these devices, which is ultrasound devices or other diagnostic things that the radiologist then remotely can interpret.